Namaste. Now we'll learn about dysentery and related disease conditions. Dysentery is actually gastroenteritis. That means it is infective or infected diarrhea. It is bloody diarrhea. There will be blood and mucus, painful stomach, cramps, vomiting, high temperature will be there. And cause can be any of these things or all of them together. Contaminated food, water, drinks, and physical contact with the infected person. There are actually two types. One is bacillary caused by bacteria, the other one is amoebic caused by amoebia. And how to diagnose this disease or to how to find out that somebody is suffering from dysentery, that is infectious diarrhea. That is by stool culture. Bacterial infection, the causative organisms are Shigella, Salmonella, and E. coli, Escherichia coli. Usually it gets better within 3 to 7 days. The main thing that we have to do is we have to avoid dehydration in this case. Any type of diarrhea or dysentery, the main cause of death is dehydration. That has to be tackled. For pain, usually paracetamol can be taken. But in extreme cases, what happens is the pathogens enter the large intestine and damage the intestinal lining, which leads to inflammatory immune responses. It leads to cramps, fever, edema, damage. That happens due to cytokines. These are released by the immune cells. Then what happens is the immune response uh, leads to the release of cytokines and they only cause the problem. This leads to disruption of the normal functioning, that is there the control mechanisms are disrupted and there is impaired nutrient absorption, water loss, then mineral loss also takes place. In some cases the pathogens can enter the bloodstream also, that would be not good. And there is anemia due to blood loss. There are two types of bacteria with regard to their mechanism of action. If the infection is due to Shigella, this infection causes the maximum deaths. Then its action is invasive. That means it invades the tissues and cells. Whereas E. coli is toxogenic. That means whatever toxins that are released, they are responsible for the condition. The treatment is usually ciprofloxacin is given, then trimethoprim and sulfamethoxazole combination is given, and hospital administration for replacement of the fluid loss that happens. So this is about the bacterial dysentery, dysentery. The other type of dysentery is amoebic dysentery, and the causative organism is Entamoeba histolytica. If the entire infection is not removed, what happens is these bacteria form a lump, they form a group together and they form a cyst and they can continue the infection. The contamination may continue. And once it is ingested, that means once it enters the digestive system through the mouth, because of the cyst that is there, it escapes the stomach acid, and once it reaches the intestine, the amoeba will be released. The treatment here is again oral rehydration only. Hospital admission is required, and then that is for fluid replacement. That is there. The drugs that are prescribed are metronidazole, paramomycin, and iodoquinol. So this is amoebic dysentery. We considered uh, bacterial dysentery earlier. Now here itself it is the right time to know about cholera. Cholera is massive or acute diarrhea. The causative organism is bacterium Vibrio cholerae, Vibrio cholerae. That is the organism. It infects the small intestines. The treatment regime is doxycycline, ciprofloxacin, azithromycin can be given, and here also rehydration is the therapy. Now, because of the havoc that is caused due to cholera, a lot of work has been done, and it has been found out that it is the zinc deficiency which is the major cause for the problems that happen in this particular infection. The toxins that are released by the cholera bacteria, they increase the production of cyclic AMP, adenosine monophosphate. Now, this causes the excessive release of electrolytes and fluids. Now, if zinc is there, it inhibits the production of cyclic AMP. In turn, what happens is secretion of fluids as well as electrolytes is inhibited. In other words, what happens is zinc improves the water and electrolyte absorption because it is not secreted at all in the intestine, it is absorbed. It also enhances the immune response. So zinc plays a very essential role, and also it increases the levels of brush border enzymes which are present in the small intestine, and these are the terminal ends. These are the terminal carbohydrate digestives. That means the carbohydrate are terminally digested by the brush border enzymes. Now, these are simple things with regard to the dysentery that is there. So, dysentery is nothing but uh, infected diarrhea. That means bloody diarrhea. Okay, gastroenteritis. Now, let us learn about two different disease conditions which are a result of this dysentery. It is one is Crohn's disease, CROHN apostrophe S. It is a chronic inflammatory bowel disease. That means over a period of time it happens. It doesn't happen. Cholera, we said it is massive acute uh, disease wherein lot of electrolytes and water are lost. So many times one will pass watery stools and all that. So that is very difficult. Cholera is difficult. Now the Crohn's disease is a chronic inflammatory bowel disease which affects the lining of the digestive tract. It can happen anywhere. The symptoms are abdominal pain, which worsens after each meal, painful bowel movements, any movement that happens, bowel movements, that is, if you are passing stool, then blood in the stool, diarrhea, then weight loss, anemia, fatigue. Other conditions, I am purposely giving a lot of symptoms that are there. I have seen number of different citations, I have seen a lot of reference I have done. It can cause joint pain, eye inflammation, skin lesions, and the cause for all this Crohn's disease is not well understood. It may be hereditary or it may be a genetic disorder, and other triggers are environmental triggers, pollution, excessive antibiotics, food itself with different type of food that we take, or infections. Any of these things could be there. And what happens here is the immune system gets confused and attacks the uh, it attacks the gastrointestinal tissues and causes inflammation. Medical diagnosis is required. That means imaging is required. The treatment is by the administration of steroids and immunosuppressants. Next is any of these things that we are discussing. My request is there should be no self medication. The purpose is here to just get the background information, the scientific background that is there, so that we should know what is it that is happening. Next condition that happens due to chronic dysentery is ulcerative colitis. In this, what happens is the innermost lining of the large intestine, colon, are infected. The colon and the rectum are infected, and the condition can be mild to severe, and increased risk of colon cancer is there. And there are subtypes of ulcerative colitis based upon which part of the colon is inflamed. Here also medical diagnosis is required. It is an autoimmune condition where the immune system mistakenly attacks the healthy tissues. Normally WBCs are released, but here the issue is totally different, and the immune system attacks the healthy tissues. The infection may have been due to virus or a parasite, or food poisoning due to bacteria, or hyperthyroidism, not hyperthyroidism. The remission can happen after a few months or years. That means it can recur again. The viruses, I just want to name the viruses that cause this condition: norovirus, rotavirus, adenovirus, cytomylovirus, the protozoa amoeba histolytica, entamoeba histolytica, which invades the colonic mucosa, and it can cause colitis. The diarrhea that happens is with blood or pus. There will be abdominal pain, cramping, weight loss, fatigue, and this cramping can happen before meals or after bowel movement. That is what happens. And it is a dangerous condition if it left untreated. Inflammation spreads to deeper layers of colon, and it can lead to a condition called as toxic megacolon, which is life threatening. Kidney failure also can happen. The treatment here is surgery to remove colon and the lining of the rectum. The diagnosis is by sigmoidoscopy. That means a thin, flexible tube with camera is inserted through the bottom, that is through the rectum. So these are the various conditions. In the earlier presentation, we learnt about diarrhea. Dysentery is infectious or bloody diarrhea, how it can be treated. Then there is amoebic dysentery. Now, if there is chronic condition, it can lead to two severe conditions known as ulcerative colitis or Crohn's disease. Both these diseases are life-threatening, caused due to chronic conditions that are there, but require medical diagnosis through imaging.